Hello, Nashville. I'm Charlie Chase, and I have an important message for you about Medicare open enrollment. I know how confusing it can be to choose the right Medicare supplement or Advantage plan, so here's some good news. My friends at Buffalo Health Advisors are here to make your decision easier. Whether you need medical coverage or help paying for dentures, hearing aids, or glasses, they have your solution. They personally match you with the right insurance plan that lets you keep your doctor with lower prescription drug costs, giving you the best coverage at the lowest price. Some at even zero premium per month. Remember, plans change every year. If you have not shopped your Medicare coverage this year or live on a fixed income, call Buffalo Health Advisors today. Buffalo Health Advisors. When you think Medicare, think Buffalo. Call now with no obligation, 615-908-2695. That number again, 615-908-2695.
Medicare is something to confuse everybody. It's insurance for older people, but you have different avenues that you can take with that. It's not just straight, here's Medicare and this is what you get. You can do a lot with it, and you learn. We help you learn what you can do with that to optimize your life and what you need and what you're looking for.
Medicaid is a program that's been designed for the less fortunate, people with low income. For the most part, it's based solely on income or lack thereof and assets. It's a state-based program, and it's for certain folks that fall in a certain demographic to help them out.
So a co-payment varies from carrier to carrier, and it can be as little as $0 to see a primary care doctor, $10. Some of them, at times, some of them have been $15 or maybe even a little bit higher. But it's your portion of what you pay when you receive a service.
Deductible is the part that an individual would pay before the insurance picks up on it.
A dollar amount that an insured person pays to transfer risk to an insurance company.
So one of the biggest things with healthcare in general, and one of the reasons
that Buffalo Health Advisors exists is because of all the confusion about what types of health insurance are available for people and what type of health insurance that people should buy. So one of the key reasons that we are an independent and we service every single type of health insurance and every single type of carrier out there is because health insurance is really specific to people's financial capabilities, what their family needs are, and what their job needs are, whatever their risk is, and finding something that can be associated with them specifically. So those are some of the things that we try to really focus on and explain to people when they're looking into healthcare.
Well, that's why you need a benefits advisor with Medicare, because there's different time periods where you can enroll and different options for individuals, and we can help you determine if you qualify for an enrollment period. But that answer depends on the individual and their situation.
So you're about to turn 65 and you want to know when to start shopping for Medicare coverage. You would want to start doing that about 3 to 6 months before your 65th birthday. You'll start to get a lot of literature in the mail, and that can be very confusing. But what you want to know is that your base benefit of Medicare A and B is an entitlement you'll get from the government, and then you'll have to cover that extra 20%, which is something that you'll need a supplemental or an advantage plan for. That's what we do at Buffalo Health Advisors, is try to help you find the appropriate plan. So cost is something that people really think about when they're looking at their health insurance, and you've already paid a lot into Medicare and you pay your Medicare Part B premiums. By calling us, most plans are zero premium. Some even pay back some of your Part B premium that you're already paying. And if not, there's supplemental products that are associated by age, by price, and we can let you know how much each one of those would cost and what exactly they would cover. When you go to select a plan, it can be very confusing. So at Buffalo Health Advisors, we have many different ways that you can learn from us or get in contact with us. We have a staff of brokers here at our Nashville office that you could talk to over the phone and get all of your information from. You can visit us at our office, one of our physical enrollment centers, which are spread around town, or we can have an agent come visit you or you and your family at your home whenever it's convenient for you. So pretty much any way that you need to get information, we can help. You can also visit our website and shop for plans there. One of the main factors that scare people when looking into insurance is not being pushed into something that they don't need or having to buy a plan or get sold something. At Buffalo Health Advisors, we're just that. We're advisors. We have no dog in the hunt. We don't work for any specific carrier. We want to make sure that you get associated with the plan that is exact fit for you so that you'll be a long-standing client and have the best possible benefits to fit your needs. So at Buffalo Health Advisors, we are an independent brokerage and we work with every carrier on the market. So some of the ones that you've heard about, like Blue Cross or Cigna or Aetna, we are absolute partners with them and they're great products. But there's many other products out there also that you might not have heard about, like Amerigroup or United Healthcare's AARP plans. So we work with every single carrier to make sure that we have all the offerings so that every plan can be specific to each individual person. With our relationships with the carriers, there's no additional cost whatsoever with working for us or working with us. So you don't have to be worried about paying extra by coming to us, and we can actually probably save you money coming to us than going directly to the carrier. The relationship with your personal physician is one of the trusted and most long-standing relationships that most people have, especially when you get into Medicare years and you're going to probably need to use those benefits more than you did beforehand. Your doctor relationship with a trusted person is something that can't be understated. So what we do is we use that relationship to try to build around to find plans that your doctor's associated with and make sure that you're getting coverage from a carrier who has a contract and is working with your doctor. So when it's time to look at your health insurance needs and you're trying to schedule, you'll want to take just a couple of hours, 1 to 2 hours with one of our brokers or benefits advisors. We'll get you all the information that you need to get enrolled in a new plan.